Module 4a, Coordination, Reporting, and Partnership in Service Delivery. Overview of collaboration in the Safe Harbor response. When you are serving trafficked, exploited, or at-risk youth in residential programming, transparent and creative collaboration is essential. Partnering with their family, child welfare, juvenile justice, and other systems professionals and community-based providers is so important. This can be done in many different ways and is often connected with the Safe Harbor Response Network. Mandatory reporting is one key part of the collaboration when there are allegations of sex trafficking or sexual exploitation of youth. As we move into this portion of the training, please keep some basics in mind. First, practices and protocols in your program will determine how much collaboration you may do with outside providers. Talk to your supervisor about what is required and what is allowed, particularly if you are new to serving this population of youth. Second, resources and community response protocols for sex-trafficked, commercially sexually exploited, and at-risk youth vary widely across the state. As you serve this population of youth, you are encouraged to connect with your Safe Harbor Regional Navigator to learn about the resources and collaborative networks available in your community and in the community to which the child will return when discharged. Mandatory reporting is an essential part of the protection of at-risk, trafficked, or exploited youth.
Voices of Safe Harbor, words of youth and survivors of sexual exploitation in Minnesota.
Beforehand, say, I'm a mandated reporter, so they know it's their job to tell. It's important to say that up front. If somebody did say it was confidential and told everyone, I'd lose trust with anyone.
Sex trafficking of a child or youth is a mandated report, and child welfare agencies are required to investigate all allegations, regardless of the identity of the alleged offender. Sex trafficking is a type of sexual exploitation of youth included in Minnesota's child protection laws. It is the only type of child abuse that must be reported, even regardless of the relationship between the alleged offender and alleged child victim. For example, if a person online arranges for a child in Minnesota to provide a sex act in exchange for something of value, this must be reported to Child Protection as alleged sex trafficking. All sexual exploitation is also a mandated report requiring a child protection investigation, but only when a parent, caregiver, or household member is the alleged offender. More information is included in the DHS Mandated Reporter Guidelines and Mandated Reporter Training online. Safe Harbor supports for sex-trafficked, exploited, and at-risk youth. Minnesota's Safe Harbor law ensures that young people who are sex trafficked or exploited are treated as victims and survivors, not criminals. A statewide network of services is coordinated through Safe Harbor.
Caroline Palmer, Minnesota Department of Health.
Safe Harbor is a statewide network designed to meet the needs of sexually exploited and trafficked youth, particularly under the age of 25. This network provides funding for supportive services, housing and shelter, and also regional navigation. It provides technical assistance. It also provides training and prevention tools. Further, the network allows referrals between different partners and is required every 2 years to provide an evaluation per requirement of the state legislature. Safe Harbor in Minnesota is based in a public health approach. From the very beginning, when Safe Harbor was created, the goal in the state was to look at this issue from a population-based public health perspective. That means that we are looking at the various ways that people who experience sex trafficking and human trafficking in general are impacted on a health level. In particular, we are making sure that we are looking at health equity and disparities within various systems that lead to increased vulnerabilities and harms for specific populations in terms of trafficking and exploitation. The no wrong door model was set up early on when Safe Harbor was first passed into law in the state of Minnesota. The no wrong door approach is to ensure that youth who engage with our system are met with open doors wherever they go to seek help. This means that through those doors, they will provide access to supportive services. That might be everything from case management to housing to prevention and anything else that a youth might need, whether it is through the child protection system, the criminal justice system, the juvenile justice system, through healthcare or advocacy. No Wrong Door was set up with a number of key values, and that included ensuring that youth would be met with a trauma-informed approach, that they would have services that built upon their strengths, and that their autonomy and agency would be respected throughout the process through confidentiality protections. It also means that our No Wrong Door system not only looks at interventions, but also prevention of trafficking and exploitation. No Wrong Door formed the process for building the system of Safe Harbor that we know now, nearly a decade later. There are 5 key values that guide Safe Harbor. They include a victim-centered approach, being trauma-informed, being culturally responsive, and also youth-centered and strengths-based. In terms of being victim-centered, that makes sure that whatever work we are doing in terms of Safe Harbor, that we are keeping the victim-survivor perspective at the center of all of our work, that we are ensuring that the victim is kept informed, that they have a say in the processes that are going on around them that affect their lives, and that they are respected throughout the whole process. So too, looking at a trauma-informed approach means that we recognize that trauma manifests in many different ways. Everyone has a different experience with trauma, and so we need to meet people where they are at. And so Safe Harbor services are built to make sure that people who are providing the services are not only trauma-informed, but also prepared to provide support and services that are specially tailored to the youth who need them. In our youth-centered and strengths-based work, we are looking to the wisdom of youth, to the experience of youth, and seeing that they have strengths to bring to the table to support in their own recovery, that they have the ability to make decisions that could affect their lives, and that they've gone through a lot, which means that they are able to talk about what they need to lead to their recovery. And finally, cultural responsiveness. It's important that throughout our work in Safe Harbor that we are providing culturally specific services, that we are prepared to build out our network so that we can provide more culturally specific support, and that organizations who are providing services are continuing to train and build up their abilities to meet the needs of youth from different backgrounds. From the very beginning, Safe Harbor has looked to the voices and experiences of survivors to inform the work. Survivors were at the state legislature testifying about the importance of a no wrong door system and about a Safe Harbor network back in 2011. Since then, they have informed different parts of the work, including participating in work groups where they help to inform policies and changes. They also assist us in our funding decisions, and they are continuously working to keep us on track to make sure that we are keeping the voices centered in all that we do. Throughout the years, we have also built policies in terms of ensuring that survivors who are participating in this work are compensated fairly for bringing their expertise to the table. Finally, we continue to include survivors in all of our planning efforts. This may include everything from developing an identification tool to building conferences and trainings, to also helping us create guidance for our child protection services. Survivors are really why we do this work. And throughout our efforts, we always need to keep survivors and their experiences at the center of everything that we do. Safe Harbor is taking a number of approaches in order to build our equity response. Part of this is building upon our partnerships within Safe Harbor and making sure that our program grantees and our multidisciplinary grantees are all approaching this work with an understanding that many youth of color are directly impacted by exploitation and trafficking in our state. And in fact, we know that there is a disproportionate impact on populations of color in our state. So one thing we need to make sure we are doing is providing culturally responsive services, and that within those services, we have referrals that are going back and forth within all of our other programs. We also want to make sure that the people who are providing services to youth are reflective of the communities of youth who are out there directly impacted by trafficking and exploitation. Another important piece of this is making sure that as we continue to build Safe Harbor, that we are doing everything through the lens of health equity and racial equity. So this includes on the state level, on the ground level, on all of the different levels that we are doing our work in Safe Harbor, that we are continuing to be aware of the direct impact of historic trauma, of other forms of trauma on the youth who are receiving our services, that we are aware of the impacts of disparate impacts within our systems, and that we are continuing to build awareness of equity within all facets of Safe Harbor. This is an ongoing process. This is something that we will always be dedicated to doing within Safe Harbor, and that we continue to direct our work through the lens of building and promoting health equity and racial equity throughout the network. 3 state agencies in Safe Harbor play a variety of roles. For example, the Minnesota Department of Health is responsible for overseeing the grants for supportive services and regional navigators. The Minnesota Department of Health also provides the biannual evaluation of Safe Harbor as required by the Minnesota State Legislature. The MDH also provides training, it provides prevention tools, and also has developed an identification tool for various disciplines to use in responding to the needs of youth and making appropriate referrals. The Minnesota Department of Human Services provides the child welfare response as well as the vulnerable adult response, and is providing the grants and oversight for Safe Harbor shelter, housing, and also street outreach. The Minnesota Department of Public Safety, through the Bureau of Criminal Apprehension, operates the Human Trafficking Investigators Task Force. It also provides a state hotline to respond to any tips about trafficking and exploitation in the state. And finally, we all partner with the Minnesota Coalition Against Sexual Assault. MNCASA is tasked with providing technical assistance for multidisciplinary protocol development for teams throughout the state who are coordinating a local response for sex trafficking and exploitation of youth. Prevention plays a crucial role in Safe Harbor. Because we are approaching Safe Harbor from a public health response, that means that prevention plays a key part in everything we do, in addition to our intervention responses. We provide a variety of prevention tools through the Minnesota Department of Health that can be used in residential settings. One of these is a set of youth outreach materials that were developed by and for youth. These are available through the website at Minnesota Department of Health, and they are also available in different languages, including Spanish, Hmong, and Somali. In addition, we also promote the use of the Not a Number curriculum, which was put together by Love 146. This is a crucial human trafficking curriculum for youth, and it is actually created for youth of all genders, and it is widely available throughout our state now through the work that has been done in our facilities. In addition, we also want to make sure that our prevention messages are echoed through our research and evaluation. So in other parts of the training, we'll be hearing about the Minnesota Student Survey, which is a key tool for us in better understanding how many youth are impacted by trafficking and exploitation in the state. Using this information, we are better able to create prevention messaging and raise awareness for youth, as well as for the adults who are encountering the youth in various settings. Another key part of our prevention effort is the development of the Minnesota Youth Trafficking and Exploitation Identification Tool. This tool was developed in partnership between the Minnesota Department of Health and the Minnesota Department of Human Services, along with input from survivors. The purpose of this tool is to help identify youth who might be trafficked and exploited, and this would include sex and labor trafficking and exploitation, in order to make the appropriate referrals for them. This operates in a couple of different ways in terms of prevention. It first off may be able to help staff and youth have initial conversations about prevention of trafficking and exploitation, and it might also play a secondary role in prevention with making sure that youth are connected with the appropriate resources so that if they are being trafficked and exploited, those resources can step in and hopefully prevent any further harm.
Safe Harbor youth outreach materials can be found at the website https://www.health.state.mn.us/communities/safe harbor/communities/youth outreach.html.